And being here. So welcome to tonight's forum on mistletoe therapy. A lot of you are my current patient, and some of you are just heard about this or were sent here by one of our friends. This is an introductory discussion about applying mistletoe for cancer therapy. So we are going to go from very basic to a little more in-depth on that. So let me share my screen. If you have questions, once I have the slides up, I cannot see your questions, but we will get to those at the end. So, and just know my dogs have been fine all day, and now I get on to do this, and they're usually not. So that is just the way that goes. Okay, there we go. Share my screen.
I just shared it, Dr. James. So if
Oh,
I can do it if you'd like.
yes.
Okay.
Okay. All right. So the screen is up. Very good. Okay, go on to the next slide. So today I just want to kind of I want plenty of time at the end to for discussion and questions and things like that. But we want to cover the basics. What is mistletoe? How does it work? How do you take it? Like what is the mechanism that it actually helps cancer patients? Because when you start to listen to people who've been using it, when you start to listen to patients who've taken it, it really does sound too good to be true. And so I'm very suspect when that happens. There's always a catch. There's always more to the story. So um, that is something that I keep in mind. I'm one of the most skeptical people when it comes to introducing something like this. So I have some pretty solid information on that. Of course, the cost is going to be a key determinant for everyone. So we'll go over that. And then again, open questions and discussion. And so as we start out, I want to just mention, and I have a couple of references here that I'll probably refer to. This is from the field of anthroposophic medicine. And as we go through here, you may ask yourself, like, why don't more doctors use mistletoe? Why isn't it part of standard of care therapy? And this is, I'm going to read this passage and you'll understand why. It has been studied probably more than any other cancer drug in history. There's over 2,000, probably more than 2,500 published studies on the use of mistletoe with various cancers in various stages. And we'll go over kind of some of the findings of that. And I have some of those references that I can send you after if you request those. But I want to read this part of this. So mistletoe therapy came out of anthroposophical medicine, which had its origin with the Austrian spiritual scientist Rudolf Steiner from 1861 and 1925. And today, clinics and institutions throughout the world, Steiner's approach is very simple, based on classical, natural scientific medicine. It supplements its methods with spiritual, scientific knowledge concerning the soul of the individual personality of the human being. According to the principles of anthroposophic medicine, both approaches belong together. It goes a step further by taking into account the state of a person's soul through speech, movements, emotional state, and in the most important life rhythms such as respiration, eating and digestion, sleeping and waking, tension and relaxation. So when you get into some of these, and any of you who've dealt with traditional oncologists or a lot of traditional physicians, they want certainty. They want a graph that shows you your survival if you do this, your survival if you do that. They want very firm data. And one of the frustrating things when you start to move into integrative medicine, and especially this branch of anthroposophic medicine, it is very much intuitive. It is very much spiritual. And the way I think of it is the nature of you're harnessing the things in nature that look like the problems to heal. So one example, I'm sure you've all seen what a walnut looks like. A walnut looks like the cross section of a brain. Walnuts are great for brains. It's great for brain health. So these are the kind of connections in anthroposophic medicine. When you look at mistletoe, mistletoe is a parasitic plant that grows on trees and it absorbs the energy of the tree. So when we look at how to decide which tree mistletoe each patient should get, it is determined by what the patient looks like, what their personality and demeanor is, what their vitality is. the aggressiveness of their tumor. So it is more complicated than just take this dose of this every 3 weeks and you move forward. It's very individualized, it's very fluid, and it's very subject to change. So that lack of certainty and that lack of a rigid protocol makes it inaccessible to most standard of care people out there. So just starting off, I wanted to start with that. So anthroposophic medicine, for any of you who want to look this up further. So anthroposophic medicine. Okay, next slide. So what actually is mistletoe? You know, it's Christmas time, and that's not by coincidence, but most of us think of mistletoe as hanging overhead and prompting a kiss. It's the same mistletoe plant that's harvested in a very different way. So it's a parasitic plant. It actually grows on trees, like I said, and the plants are different and the trees are different, and they all have different properties, and then different companies harness the power of the plant in different ways. And what's fascinating as we get into at some level of detail tonight, the berries have a different properties than the leaves and the stems do. And so it's the combination that they take when they combine those together, as well as in the summertime, plants bloom and expand, and so they harvest once during the summer to capture that energy of the plant, and then in winter it shrinks down and comes within and consolidates. And so one of these companies harvests in the summer and the winter, and then they have a special way they mix the two of them to get the benefit of each of those. And they're very specific. There are patterns of ways that you change these up if somebody stops responding, and you have to make adjustments to treatment. So the most common ones are fir. Fir is really it. So Viscum album is the name of the plant, Viscum album, and the ones that grow on fir are Alleviates. So Viscum album Alleviates. On the apple tree is Viscum album Mollie, Mali, Viscum album Mollie, and then Viscum album Pinny for pine. So fir is for more sensitive people, more soft-hearted people. Apple is more for, if you think of that round apple figure, rotund people, more robust people. And then pine is for more the tall, thin constitution people. That's kind of one start to how you start to apply this and pick which type of mistletoe is for each patient. So there are a number of other ones that come from different plants and are harvested in different ways. Birch is one of them. I believe the birch, and if you think, I believe the birch tree is very white. So it brings a major lightness to people who may have kind of a dark vitality to them. So just some interesting caveats as you get into all the nuances of the different ones. But we're going to start very basic with the fir, the apple, and the pine, the Alleviates, the Mollie, and the Pinny as we launch this with our patients. And then we're going to get more sophisticated as we go. So again, they're classified based on the tree that is grown in, the company that harvests it, and then the strength. And the strength is not all the same. It's not a milligrams. Some of them are milligrams, some of them are more of a rating scale from A to H. So there's some complexities to that. Oh, there we go. Great question. How familiar are you with mistletoe therapy? Megan, can they see all the questions?
Sorry, I was trying to unmute. We still have some responses coming in, so I'm waiting for those to,
Okay, but they can see the first two questions?
yes,
Okay, perfect.
and I'm sharing results.
Okay, question one is how familiar are you with mistletoe therapy? And question two, are you or a loved one currently navigating a cancer diagnosis? So can they see that live? Yes, I think you guys can see that live. So So a lot of you, this is your first time hearing about it, or maybe you've heard it mentioned, but you don't know a lot about it. So that's great because we're expanding the knowledge on this. I'm excited about that. Okay, thanks, Katie. And then you or a loved one are dealing with cancer. So, and then if you're just here to learn, this is going to be an amazing thing. If you've ever had a family member dealing with cancer, people come out of the woodwork with different stories and things. So you want to be careful how you share this with people, but I think when you see what it can do to help them, um, you'll want to share it frequently. So, all right, next slide, please. Perfect. So how does it actually work? This is getting into the science of it, and this there's a lot to this. So I want to break it down. So there's two main parts of the plant. There's the viscotoxins and there's the lectins. And lectins are something that we think of in like beans and plants. It's an immune activating substance. But there's all of these other things in there as well. So glycoproteins as part of the plant, polypeptides, oligo and polysaccharides. So there's about 30 different mechanisms that this affects cancer. And the way it does that, some of those are it actually pokes holes in the cell wall of the cancer so that it just breaks up and is destroyed. Some of those are regulating your immune system to come and attack the cancer cells. And it's a good combination of both of those. So most of us now think of cancer as a metabolic disease. But I want you to add a layer to that. It's a metabolic issue with immune dysregulation because we make cancer cells every day and our immune system's able to knock those out and take them out. So not only do you have to have the metabolic process, you have to have a failure of the immune system to deal with it in order for that to progress to a cancer. So one of the main things that happens when we're injecting mistletoe into the patient, and we'll go into how that happens, is it stimulates an immune response and it regulates that chronic inflammation back to acute inflammation. One of the big things that it does and principles that it works on is causing a warmness or a fever. So one of the things about cancers is they're very dependent on sugar. They are very dependent on specific resources, and they're unstable with much of a temperature dysregulation. So this is why freezing tumors seems to be popular, but hyperthermia has been a treatment protocol or incorporated into cancer treatment for a long time. So if you freeze and then heat a cancer, you're getting the best of both to take those down. And that's, again, those are strategies not frequently used in as much in traditional cancer care. And I do want to mention as well, this is standard of care in Europe. This has been studied at major academic centers here in the United States in stage 4 cancer. So these are all the things I'm just going to kind of go through here. Inhibits protein synthesis. So for a cancer cell to divide, it has to make new proteins to build another cancer cell. So it stops that. It can be cytotoxic directly. So like I said, going in and punching holes in the wall of that cell and breaking it down and killing it directly. Cell membrane leakage. Immune-mediated tumor inhibition. So again, teaching our immune system to go after this and attack the cancer. Quercetin derivatives. So some of you have seen quercetin in the integrative cancer care. I don't usually use it because there's just so many things you can take in a day, but it induces apoptosis. So here's the tumor effects. And triterpenes, this is kind of some of the reactive species you get with ozone therapy as well. Induction of apoptosis, cellular differentiation, and angiogenesis. So these are your direct tumor effects. And then here are your immune effects of those same things. So macrophages, this is what comes from the tissues to eat these cancer cells up, TNF alpha to tag them, increase in immune response, antioxidant, anti-inflammatory, anti-nociceptive. So one of the big things it's going to do is help with chronic or cancer pain. And people who can't get that controlled with other means, it's really going to come in and give that stress protection, immunoprotection, anti-inflammatory, antioxidant. So there's so many different mechanisms that this one treatment does. You couldn't get this with multiple prescriptions. So this is a very powerful slide. But what does it actually do when you inject it? So these are great, right? But what does it mean for patients? Next slide, please. So it regulates the immune system. Again, a lot of people fall into that Th2 helper cell 2 chronic inflammatory pathway, and we need to get that more back to Th1 activation, acute inflammation, where the immune system's coming in and cleaning up the damage, not just kind of ignoring it. Alleviating pain, helping with quality of life and vitality. A number of the different doctors who've been using this say, I can just tell within one treatment, they just come back to themselves. They come back alive. So for people who are really kind of getting lost in their treatment or lost in their disease process, it helps bring back that light. Inhibiting metastasis. So anti-angiogenic. So it stops the blood vessel formation, it stops the ability of these cancers to spread. This one's really important. The next one, reducing side effects from chemo and radiation. This is a treatment that can be added alongside of most every other treatment out there, standard of care or integrative, but it has to be done properly. So, for someone who's undergoing standard of care, again, we always advocate for like the vitamin C and the MAH, the IV ozone. This is another tool in our arsenal, especially for those patients who aren't geographically convenient for those treatments. You can do this at home and it can help tolerate and help those treatments really work better. Lowering VEGF and stimulating the bone marrow. So you're not getting that immunosuppression. You're not getting those anemias. You're not getting those blood count significant effects that you do with standard of care treatment. So all positive things. What would be the most valuable outcome for you or a loved one from mistletoe therapy? So there's your survey.
Lots of responses coming in. I'll give it a couple more seconds.
Mm-hmm. All right. So improved quality of life is up there, pain management, reduced side effects from chemo radiation, or just better overall vitality. All good things, right? So that's the one thing I'm proud of moving in this integrative cancer space is the treatments that we have to offer are generally well tolerated and they're going to help the patient feel better, let alone helping with their cancer. So important things. So how do we actually give it? Here's a caveat that I want to make sure that you all know because you can go to Amazon and find everything. And the same is true with oral mistletoe. This is a homeopathic treatment as it's approved in the United States. So every homeopathic treatment has to be listed as oral and it has to have an indication. So when you look at the boxes of mistletoe, it says it gives directions for oral administration and it says for temporary relief of headaches. We don't care. That gets it through the door so we can use it in this country. We are going to be giving it as subcutaneous injections. That is the bulk of what we're talking about tonight. There are going to be instances where we can do it IV and we can do it intratumorally. We're not getting to those right now. We're going to start and we're referring to the subcutaneous injections. So it comes in a package with 8 ampules. It's given every other day or Monday, Wednesday, Friday, 3 days a week, every other day. And you can do this at home. And we watch for a significant response on that. And then we help you guide. So you start at a very low dose. And what we want is we want to see at that injection site that we've created like a wasp sting or a bee sting about the size of a quarter. And once we have an immune response, then we're going to continue with that dose until we stop seeing it. Then we're going to go to the next higher dose and then keep going. And there's a lot of caveats and nuances to how that is done, but that is overall what we're looking at. All right, next slide, please. So when do you start mistletoe? This is something that you want to do as soon as you're diagnosed, and as soon as you know about it. So as early as possible in the diagnosis is where we want to start this. If someone's contemplating surgery, chemo, radiation, starting this prior to that would be beneficial in most cases. You can start it later, and some of you are actually coming in a recovery phase where you may want to incorporate it in part of that keeping the cancer away part of life. So, in that, we downshift quite a bit from 6 weeks on, 6 weeks off to maybe once a quarter or twice a year doing a series of mistletoe. So, just to keep our immune system fresh and engaged and fired up against any tumors that recur.
And we did have a question that asked if it's injected into the same place every time.
Yeah, so you do want to move the injection around. Generally, I've found the easiest place to do subcutaneous injections are on the abdomen. So you just pinch a little bit of fat and inject right in there. It's a very small needle, very similar to an insulin needle, a little bit bigger maybe than an insulin needle. You're going to move that site around because you're always going to look for that response, and you want a different response site each time. Um, and actually, one of the nuances is it's more responsive on the thighs. So if we're not seeing a response in the abdominal injections, we may have a patient move it to a thigh. So we can see if there actually is a response that we're just not seeing on the abdomen, or if there's no response and we have to change our therapy. So those are kind of the cornerstones of that. So again, it can be combined with almost every treatment. There's some nuances. If you're doing another immunotherapy through conventional, we want to alternate days or have some offset there. There's also specific ways to give it with IV vitamin C so that it's not contraindicated. They're not contradicting each other. So those are important things we need to keep in mind. And I strongly encourage, all of our patients to start this because it will reduce side effects from other things. Um, One of the things we have to be mindful of is it's going to stimulate an immune response. So say you have a solid tumor. I'm just going to say one size of a golf ball. If we start treatment, what's going to happen is that will be infiltrated with immune tissue, and the cancer can actually, the tumor can look like it's getting bigger. So we want to be really thoughtful how we time any kind of imaging studies around that or any kind of blood counts, because it is going to stimulate your immune system. It is going to make things look bigger up front and then shrink down over time. So it's like pseudo progression of the tumor. So we need to make sure we know what's going on with your treatment and your imaging and being strategic about all of those things. So how long do I take mistletoe therapy? Most doctors plan on starting a 2-year course during or after treatment. And then, like I said, once a patient is in remission or no evidence of disease, 1 box per season, or that we can come up with something more custom for them. So an important thing to keep in mind though is we're always going to include a subcutaneous component of this, because most of the immune system that we're trying to activate is actually in the tissue. So giving this IV alone is not going to work as well, because what happens, you miss that macrophage activation from the tissue part of the immune system. So you always need to do that part of it, even if you do the IV as well for more aggressive or late stage tumors or patients who are really struggling. So who should not do mistletoe? Things we need to be aware of, since it does stimulate the immune system. If they're in a hyperimmune response, so, just coming off of septic shock or septic infections or things like that, we need to be mindful. And also, if they're flaring with autoimmune or inflammatory or the cachectic side of things, we have to be a little bit more cautious in those patients, bring them back to center. A lot of our patients have heard me say, we've got to keep it between the guide rails. And a lot of times in trying to smash the cancer, the patient gets really hit hard in that process. So we have to make sure the patient is built up enough to tolerate the treatment so it works, but not so much that it is causing harm to them. So again, we may not be able to start with mistletoe right out of the gates if we're in a super hyperimmune response. We may have to calm that down with some other things, and then shift over to mistletoe with time. So that's
And
an important to keep in mind.
we had a few questions come in. One of them is there a protocol for preventing cancer? Can this be
So
used?
you actually can use it for prevention. I would say that falls within everything we do at James Clinic anyway, because we optimize function, vitamin D, nutrient levels, all of the high risk things that we're looking for anyway. We can utilize it as part of that.
And are there specific types of cancer where this therapy has shown the most benefit?
You can actually use it in most cancer processes because it is a generic response as far as how it affects the cells and how it affects the immune system. So I believe there are studies in all solid tumors and blood cancers because of the mechanism that it has.
And last one I'll ask for at this time is there a risk of overstimulating the immune system?
Yes. So this is why one of the things we had to prepare for before we launched this is if you undergo mistletoe therapy through our clinic, you're going to need to be touching base with our team frequently. So as you're doing these injections, you're going to have to photograph your response, send it in, and communicate with our team. Same dose, higher dose, or pause on treatment. Because if we do overstimulate and we create, it's not an allergic reaction, but it's a hyperstimulation, you can get to a point where you can no longer use this treatment. So we really have to be cautious and back that down, wait for the immune response to resolve and change approach, shift approaches. So either a different type or a different dose or a different injection site, so that we can keep the efficacy of that treatment going. Yeah. So this comes, I'm always kind of warning people things on Amazon are not always what they appear. And I buy a lot of books there. So but I found oral mistletoe. Can I just take that? And the answer is no. None of the studies are done on oral mistletoe. And think about gastric acid breaks down a lot of the food that we eat. So it's gonna break down a lot of the plant properties of what mistletoe is trying to bring to the table. Again, IV in certain instances, clinically, we would do that in our office. And we're not going to start out with that, but we'll be adding that later this year. So, but no, oral mistletoe is not going to do the same thing as what we're talking about. So how do I get it? How much is it? We are going to run this out of our office for our patients. And if you're not our patient and would like to become our patient and have us help you manage this, we have a process for that in place as well. We're happy to talk to you. So there are a couple of different ways, a couple of different kinds of boxes to order. One is a series box where it's an escalating dose, so we can find which dose do you need as you're getting started. Once we have a response, then you would get that dose um, to take until as long as you have a response. So there's different ways to order this, and most people need. So there's 8 ampules per box. And the average month has 4 weeks with 3 injections a week. So you need 12 doses. So most patients are going to need 1.5 boxes per month. So the cost of this, I didn't include that. We're still working out the details. It looks like the actual mistletoe is going to fall, and it's dependent on the dose that you need and the type of mistletoe that we prescribe. So it looks like it's going to start around 150 a month, and it looks like the high end of that is around 350. I don't think it's ever going to go over 500 a month unless we're incorporating IV mistletoe as well, because the doses of that are much higher. So for the approaches we're doing now, we're looking at 150 to 350 a month for the treatment. So you guys can see the poll. What's your biggest frustration with traditional cancer care? And does your oncologist support combining traditional and integrative therapies like mistletoe?
I'll keep it up for a few more seconds. Quite a bit coming in. And if anyone has any of their own questions, you can add them to the chat, or there's a Q&A box you can add them to, either one, and we'll get to both of those.
Yeah, we'll have plenty of time for questions. Okay, so the biggest frustration with traditional cancer care, the lack of holistic options. I think that's reasonable. You know, as I've said since we started on this journey, patients just want to get better. They don't care if we call it integrative, natural, holistic, traditional, standard of care. Just get me better and keep me alive and keep my quality of life good. So, I've found that integrative medicine has such a strong role in doing that. I don't feel like most of our patients look and feel like cancer patients. They just have it. It's just like having high blood pressure. They have an issue we're dealing with behind the scenes and they look good and they keep going. It's not true for 100% of people, but a lot of them, quality of life is just so much better. And then does your oncologist support combining traditional and integrative therapies like mistletoe? Um, Most of you actually don't know, and some of you know that they don't. 5% encourage it. That sounds about right. Um, And I know a lot of really good people that are oncologists, good humans. They went into this because they genuinely care about people. It's a very challenging field of medicine. I'm frustrated by the lack of curiosity and the lack of open mindedness. So I remember one of my patients, or one of the wife of one of our patients had he had a glioblastoma multiforme. And I remember when he passed, she just called and shooed on their doctor and said, when your success rate is 3% and 97% of the time you fail, aren't you curious if there are better things that can be out there to help your patients? And I think that's what we see. And I saw it during COVID in the ICU. Like, aren't you curious that there's a better way to do this? And if someone tells you there's a better way, aren't you wanting to be involved in that, or at least be open minded to it, as opposed to just closing off to that when you don't have a good success rate? And I think that's a different story if you're extremely successful and your patients do well with what you have. But we know that about 20% of cancers are going to respond to these newer drugs, um, the different immunologic treatments that are out there. 20% of people respond to those. That means 80% don't have a good solution. And a lot of the treatments that are out there are going to push patients into a secondary cancer if they do survive their initial cancer. So this is exploding. It's exploding now after the COVID shots. You know, we knocked out P53, the tumor suppressor gene. There is a way to turn that back on, believe it or not. There are ways to do that. And we want to help our patients do those things. Um, I think, Megan, shall we go through the questions in the Q&A first?
Yes, that sounds good. We have a lot in the chat as well, so.
Okay, let's just start in the QA and then we'll go to the chat. Okay. So, can I use mistletoe therapy after I finish my maintenance therapy for ovarian cancer to prevent a recurrence? I certainly wouldn't wait until you finish. I would incorporate that and do it while you're doing treatment. There's no reason to wait, but if you wanted to wait, yes, you certainly could. But I wouldn't want to miss that opportunity to incorporate it early. Have you heard of this being used for papillary thyroid cancer after it has been surgically removed? I'm sure it can be. Papillary thyroid cancer is one of the few that almost completely is cured with surgical resection. So that would be more of a just a post-preventive issue. But yes, I would definitely incorporate it with that. The next question, are there any conflicts with current protocols? So the main thing that you would want to avoid, so the main contraindications, one, any current immunotherapies, we would not give mistletoe on the same day as an immunotherapy. Also, there are a couple of anaphylactic reactions that can cross with mistletoe. So we would do test doses for those patients and make sure they don't have an anaphylactic reaction in the office. But no, other than that, pretty much it's been looked at with almost every treatment out there and can be given alongside of those. So, does this require in-clinic visits? So the nice thing about mistletoe is it actually can be shipped to you. Um, and this is a state by state question. I'm going to have you call in individually. So we're licensed in a number of states. We have patients in I'm close to all 50 states at this point. So some patients do come in and have an initial consult in the office and kick their treatment off in the office. Um, so you may require in-clinic visits to get started, yes. But a lot of it we can do virtually. Do you recommend telling the oncologist about this? They don't know about my other alternative treatments. I used to recommend telling all of your doctors about all of the things that you're taking. Unfortunately, that has changed. So I think the way I approach this is asking your doctor something about, hey, have you heard of ivermectin for cancer? And you just ask it in a question and see what kind of a response that you get. Um, That'll tell you if you wanna pursue that further or not. I've heard of every reaction under the sun. I've heard of, sure, do whatever you can to help you, and that's kinda when they've given up or they don't have good options left. I've heard, sure, you can do that, but just be careful or don't tell me about it. And I've had people told by their oncologist, you were just wasting your money by putting orange juice in your veins, which is ridiculous. So there's every spectrum of the bandwidth. So I would approach it carefully if you plan to stay with that doctor. Um, I tell you what, I'm really to the point that if a doctor's not on your team, I don't want them on my team. You know, if you're not going to support what I'm going to do, or at least there's no allowing it, there's supporting it. And if they're not willing to be curious and support it, they're not going to be on my medical team for sure. Now I'm in a little different boat because I can pick my doctors out of, my network, but we can help you find someone that's gonna support you. Do you have to join your plan to have this administered? So you get to join our plan if you'd like to have this treatment. Um, I wouldn't go this on your own. We've invested a lot of time and money to become experts at managing this. I've done this course 3 times before I'm introducing it to patients, and we're still going to have questions. So, if you feel like you want to go this on your own, you're welcome to. But as one of my team members pointed out, going through this is a pretty trying time for most people. And so to have guidance and have people who are on your team who celebrate your wins with you and who will listen when you're having problems and offer direction, I think 200 a month is a pretty good value. Do you monitor specific biomarkers to measure the impact of this therapy? Yes, we absolutely do. As you may be aware, we're undergoing a comprehensive, this is one piece of the comprehensive cancer training our entire clinic is going through right now. We do monthly labs in our patients. We follow things like the neutrophil to lymphocyte ratios. Look that up. That's highly correlated with cancer outcomes, and most doctors completely ignore this, despite the fact that it's on every CBC they order. On nearly every patient on standard of care treatment has a neutrophil to lymphocyte ratio that is off. Um, and nothing happens. Nobody makes changes to the care. So we just look at this incorrect lab and we just keep pounding with the hammer, and it's very frustrating. Um, is this used for any autoimmune diseases? I believe it can be. Um, I believe that it can be over time because again, it's regulating the immune system. So that's not where we're going to start with treatment, but it is something that we may incorporate down the road. All right, next question.
Okay, moving to the chat. Looks like we're
Yep.
done with the question box.
Yep.
Has this been shown to help with neuropathy, taste, hand
I'm
and
gonna
foot
try.
syndrome?
Yeah, it helps me to read it. So, um,
Been quite a scroll up a little bit. There's been quite a few messages.
yep. All right, it has helped neuropathy. Um, I don't know about neuropathy per se. I wouldn't expect it to. Again, with neuropathy, things that we're looking at are going to be N-acetylcysteine, alpha lipoic acid infusions, vitamin C infusions, things like that. So that's where I would start with neuropathy specific treatments. Can it be used for brain cancers? So again, one of the things I talked about is this can make a tumor swell. So when you're talking about brain cancers, you have to be extremely careful because you're in an enclosed space in the skull. And if I make something, if you make a tumor grow, basically it puts more pressure and can make the symptoms worse. So yes, it can be used. Brain cancers are highly metabolically sensitive. So I wouldn't just go out and nilly-willy inject mistletoe therapy. I would do that in a way, first of all, I would get the metabolic piece on track, and you want to use a specific preparation of mistletoe that's not going to cause as much swelling to start with. So I have not told my oncologist about my other alternative treatments. Do you think I have to tell them about this? The oncologist is never hopeful. Well, first of all, I would question going to an oncologist that's never hopeful. Um, Again, you can tell them about it, and if they're not on your team, then they're not on your team anymore. So, um, it's up to you to make those calls. I know some people like your doctor's your lifeline and it's hard to replace them, or you have a good relationship, but they just aren't open-minded. So everyone's in a different place with that. But if, you know, I'm certainly not going to pay somebody to be an expert that's going to tell me I'm not doing the right thing or not supportive of my choices. So I wouldn't pay a lawyer that gives me bad legal advice either. Richard says, is this something that could be considered a possible cure for stage 4? So asking a question like that can get me in a lot of trouble with the FDA. So I can't answer that question directly. What I can tell you is there are cancer stages of all kinds that have shown complete response. So I don't cure anything, I treat and we monitor. So I think there's a lot of patients who are in an advanced stage cancer, stage 3 and stage 4, where it's metastatic, that feel hopeless or the system gives up on, and we don't do that. So I also try to be extremely realistic when people are investing in treatments with us. Um, I tell them if we're going for, if you want a Hail Mary, we can go for a Hail Mary until you don't. But I also don't give false hope to people. So depending where they are in stage 4 and how beaten down they are, how much chemotherapy and traditional care they've had, I think there's reason to be optimistic. Do you feel that cancers that have exploded with COVID have a greater or lesser chance of responding to mistletoe? That I don't know yet. We just don't have the numbers under our belt to know that. And again, we're incorporating so many different components of what we do, the metabolic, the supplements, the vitamin optimization. I don't know which piece of it is moving the needle the most, but I have a reason to be optimistic that they will all respond in some way to mistletoe. How do you turn the P53 tumor suppressor gene back on? Um, There's actually several ways to do that, and I don't recall the list offhand, but there are ways to get that working again. So, I can't remember if mistletoe is one of them specifically. When will the clinic start this therapy? We've got a box with your name on it very soon. So, yes, we have ordered it. It's a little bit delayed over the holidays, but hopefully by the end of this week or early next week, we can get therapy started to anyone who needs it. Sherry Archer and Anita Hoke are going to kind of lead this effort. and will be the point of contact for our patients starting it. So there'll be a lot of contact with us, out of the gates for sure. Are you going to offer a class to teach them how to incorporate this? I will actually connect you with the class for you to learn. Maybe down the road, that's something that we would incorporate. But for now, we are, it's really hard to incorporate new treatments when you're in practice because there's always a learning curve. So we're still partially on that learning curve. But like I said, we got to critical mass before we're offering it to our patients publicly. So. Do you inject closest to where the cancer is in the body? Not necessarily. Patients generally inject into the abdomen. Again, you can do a thigh or hip. Um, and then the intertumoral injections are going to be done, like in a radiology center with image guidance. So we're not doing that yet. That's going to be down the road, but as a surgeon, I was trained how to do a lot of those things, especially in the breast. So I think it's something that within a year or so we'll be bringing online. And yeah. Is it okay to use this with all the other alternative treatments like ivermectin and fenben? Yes, it is. An interesting thing, as I'm going through this, there's the press pulse therapy, right? So you don't ever there's actually two different schools of thought. One is if something works, don't stop it. And the other is if something works, press it and then pulse it and pull it back. So you put pressure on the tumor and then you pull it back and let it work. And then you hit it again from a different angle. So there's a combination of those two approaches that we balance. So, but yes, it's safe with those treatments. Okay, next question. How can you help those out of your state? Can you come alongside those out of state? How can I connect with you, discuss options that are available? So again, if you're not currently a patient of ours, the best way to do this is just call and talk to one of my patient specialists. They will know based on where you're located. A lot of times if you're out of state and out of our region, we'd like you to come in, meet us in person once. Sometimes we'll do a virtual first and plan what that first trip looks like in case you want to do some vitamin C or ozone while you're in our office to get things started. And then we can do a lot of follow up virtually. So, yes, we can walk alongside you virtually. It's always, I think there's just the electromagnetic waves of our heart want to be in personal contact with people, especially in the healing space. So I don't ever like to do all of it virtually. But also it's a cost issue, it's a convenience issue. So we make the best of all of those combinations. I had radiation to the breast for low grade cancer 5 years ago. Would this help repair any damage from the radiation? I don't know that it specifically cleans up radiation damage as much as would treat any lingering cancer cells that are there or whatever the soup is, the terrain is that caused the cancer in the first place, would allow that to be, we look at that comprehensively to try to figure out why did you have cancer in the first place and how can we reduce that risk. Um, yes. So please comment again on how do you do this when you're doing IV vitamin C. Um, so one of the things to keep in mind is we're trying to warm our patients with the mistletoe. It's a very warming thermogenic treatment. It can induce fevers in some patients. Vitamin C is cold. So again, a lot of where we're coming to the table as a different kind of clinic is we know how to combine those. So, the timing to give for each patient around their other treatments and around that treatment is going to be very specific to each patient. If the tumor is going to swell, is there a chance for it to burst? So these are not encapsulated tumors like a balloon where it's just going to pop. These are collections of cells that get bigger and swollen. So no, I wouldn't be concerned about a bursting situation as much as it just puts pressure on surrounding structures. So in the brain, you don't have a lot of room for swelling. So it can create a lot of neurologic issues with minimal swelling where, if something's in the liver or the breast, you kind of have a little bit more forgiveness or tolerance for that to get bigger. What was the third thing you said about neuropathy, vitamin C infusions, NAC, and ALA, alpha lipoic acid? Um, alpha lipoic acid is actually, I believe, FDA approved for chemo-induced neuropathy as well as diabetic neuropathy, and we've seen good success with that in our office. We do it as an infusion with oral in between. We have a few other treatments for neuropathy that actually work incredibly well also, but those are individualized. How long does the swelling last? It depends. It's usually an initial thing. So I would think the first month or so, and then at, 4 to 8 weeks, you would see that starting to resolve and, tumor starting to shrink. Those are a lot of really fabulous questions. I'll do last call for questions. Are there more in the QA or did we get them all? I think there's a couple here.
Yeah, four more in there.
Okay. The first one I got and the second one I got. The third one, do you treat for radiation poisoning? So we have a number of things that are going to help patients going through radiation therapy. Mistletoe or melatonin is one of them that we use. And we have specific protocols for patients who are undergoing x-rays and imaging. We want to be strategic with scans. 4 CT scans is equivalent to um, exposure at Hiroshima, a nuclear disaster. So if you think about people who are getting CT scans every 3 to 4 months for 5 years, that adds up very quickly. So we want to be mindful of what scans we're getting. How does it change treatment? What is it going to tell us? Do we need the scan? Is there a better way to get it? And is there alternate scanning that would be reasonable? So that is something that we are mindful with all of our patients. What do you think the benefits would be to do this with IMRT for prostate cancer? So it's radiation therapy, but can we give her a mic? And I don't know what IM is. IMRT.
Tammy, if you could answer in the chat. I don't.
So anyway, would there be benefit to do this with radiation therapy for prostate cancer? Yes, definitely. There definitely would be. So, and actually this is kind of a funny thing that came out of a different cancer course. Intensity modulated. Okay, thank you. I just hadn't heard that term. So yes, and one of the things that we talk about for pelvic cancers is stagnation in the pelvis. So a lot of people get stiff, they're not moving around. So I think I told a couple of you on here, get a hula hoop and get out there and circle your hips to get that lymphatic drainage and get things moving in there so it's not so stagnant. So, wear your James Clinic shirt when you stand outside and tell people you're treating cancer with your hula hoop, please. Okay, for COVID, how does ivermectin affect Coumadin as a blood thinner? Yeah, that would be one of the contraindications. So, if you're going to take ivermectin, if you're on warfarin, it has to be closely monitored, and we do that individually for our patients.
And another
Yeah.
question came in.
Yeah, I think after this we'll wrap it. What would be a good initial resource to provide in approaching a family member that seems closed off to holistic alternatives to cancer treatment? That is a great question. I think that's a very individual question, and I think it depends where they are on their track, their journey. Um, Unfortunately, we ran into this with COVID. You can't help people who aren't open-minded. So if they're not, this is where we tell patients like the patient needs to call us. We can't call them. We don't want to be in the middle of that. If they don't want what we have to offer, then that's okay. I think when you get someone who's in a pretty desperate spot, when they don't feel well, when nothing's helping them, unfortunately, that's probably the place to say, hey, have you heard of this or have you heard of that? Or why don't you try an infusion and see if it helps you? So otherwise, good initial resources. There's a lot of books out there, Metabolic Approach to Cancer, Thomas Seyfried, Nasha Winters, finding stories of people with their cancer who've had a good turnaround. There's a couple of cancer clinics that just have inventories of people who've done well. So where can we find this? So we will have this posted to our YouTube channel. So you can share that from our YouTube and we would appreciate if you do. A lot of people watch this afterwards. I hope we don't get censored. And we do have to be careful how we approach this because this is an adjuvant to cancer recovery. So, you know, we can't say we're treating cancer with it or anything like that. It's just an adjuvant to cancer recovery. It's going to support your recovery. So, and this is why it's so hard as a patient. The FDA has made it intentionally hard, because we can't make claims. And this may, you know, this very well may cure stage 4 cancer for a number of patients, but we can't say that. So it's intentionally difficult to find true options. And one of my biggest pet peeves are integrative cancer centers at major cancer centers. If you look at your biggest university or academic center by you, they'll say they have an integrative cancer center. And when you look and see what they offer, maybe it's a massage and some music therapy. It is not what we are talking about, a true integrative cancer approach where we're looking at causes, terrain, metabolics, labs, and integrating these therapies that you can't get at those facilities. So those are fake integrative cancer centers. That is not what we're doing here. So please do share. We are censored still. You want my people on your team. They are the best around, and yeah, we'd be happy to help you. So if you're not currently our patient, you'd like to become our patient, you can email us hello@jamesclinic.com. You can call us 636-751-9440, and they will give you information how to get started with us. We appreciate all of you with us. I see one hand, so we'll take that and then we'll call it a wrap.
Teresa, you have the floor.
Teresa, you might be muted. We can't hear you.
It says talking permitted on her side. It's permitted on our side.
Hmm.
If you want
Teresa?
to enter in the chat, you can. I'm not sure what's.
Steve, do you want to go ahead?
I guess you heard doors, right? So,
Yes.
yeah, really interesting.
I think, are you guys both on there? We're getting a little echo and feedback.
Yeah, here, I'll shut mine. Now you won't. Oh,
If you mute and silence one of them, it'll work.
Mine's muted.
Okay.
all right,
Hang on a minute.
we're done.
I'll allow Robin to talk and then we can wrap up.
Yep. Okay. Robin?
Hello.
Hi, Kurt.
Hey, Rob. Hey. Hi, Dr. James. Thanks for doing this.
Happy to.
Appreciate
Thank you.
it. I think you answered all our questions for now.
Great. If you are our patient and you want to get started, you can email us at the same number or give us a call tomorrow. And probably email is best, hello@jamesclinic.com. Just let us know. And as soon as that comes in, we'll get in touch with you with which one you should be started on and what the price is. And then once we get a thumbs up, we'll get it out to you. So we're just as soon as we can get that going, we will. So Steve, did you have anything else you wanted to add?
So that's Hello James Clinic.
hello@James Clinic, or you can talk to us when you're in the clinic.
That's not the next Wednesday.
Okay. Just shoot us an email then, and I'll be working on it over New Year's if it comes in. So we'll
Okay.
get it out to you as soon as we can.
All right, thanks.
Thanks, everybody. Once again, it's hello@jamesclinic.com or call us 636-751-9440. Make sure you're following us on social media @James_clinic, @James_clinic on Instagram and Twitter. And then our website is jamesclinic.com. So take care, everybody. Thanks again, and good night.